Vayu Mudra will work great. When you go to a function or a festival where you take heavy food or after eating, if you feel stomach is bloated, then what happens? It will come out. So if you can do this mudra will show immediate result. Even 15-20 minutes you can feel, even sometimes that 15-20 minutes is enough to reduce the bloating. If not, you have to do it for longer time. Always you have to touch it very gently. It's better to do mudra in both hands. Same mudra in both hands. There are different mudras also, but this mudra has to be done in the both hands. It's better always mudras for best benefit. It's better to do with pranayama or meditation. Or to keep your spine erect, do pranayama, meditation with mudras to give you maximum benefits. Even in body pains, this mudra is very helpful. How to do this mudra? Touch the tip of the index finger at the base of the thumb and 3 fingers straight. Always palm should be facing sky. Back side of the hand should be on your thighs. If everyone show your hands, if any corrections, I can make you. If not, I don't know whether you are doing mudra right or wrong. Yes. Good. Very good. This is Vayu Mudra. This is Gnana Mudra. So we are doing, and very gently, don't press it. Suppose if I say 15 to 20 minutes, for after 2 or 3 minutes, your hand is getting pain. Then what to do? Then take a break for 1 hour. Again, you can do this mudra. Okay. What happens with gastric? One more will be there. What happens if you eat spicy food? Immediately what you feel? After eating spicy food, what is the other thing? Acidity, right? What happens? That burning sensation you will feel, right? It is called as acidity, or you can feel this heart burns or chest burns. You'll feel burning sensation in the heart or chest region. Especially it comes when you are eating this spicy food. If you have gastric, then it will come more because gas will move the fire. So what to do in this condition? You have to do Jala Mudra. What is Jala Mudra? If anybody has acidity, just do Jala Mudra for 15-20 minutes. After 20 minutes, I'll ask. Touch the tip of little finger with the tip of the thumb. And 3 fingers should be straight and always palms facing upwards and back side of the hand on the thighs. When you do this, not only acidity, any burning sensation in the body will reduce. If anybody has acidity, just do this mudra for 15-20 minutes. If it is very chronic, then you have to do it for few days. If it is just recent, you do 15-20 minutes, you can see a great change. But like always, mudras has to be done until and unless the problem is solved. There are few mudras. You can do it every day. There is no issue. But this therapeutic mudras, you have to do only when you have the problem. You have to stop once the problem is solved. Like whatever Vayu Mudra, Jala Mudra, Like if you have Gnana Mudra, you can do it every day. This is very good for everyone. For children, it helps in studies. Whoever is studying, who is a student, has to do this Gnana Mudra. In elders, it helps in regaining the memory. Generally, we say the older people says, I forgot this, I forgot that. There will be a memory loss. And whoever has lack of concentration, to improve your concentration, to improve the memory, this mudra will work great. What is a mudra? It is Gnana Mudra. How to do it? Touch the tip of the index finger with the tip of the thumb. See, it is like a circle. See here, always it should be the tip. Never touch the nail. If you touch the nail, the property will change, the circuit will change. And one more basic thing, basic rule, if you are doing mudras, there should not be any nails. Very, very important thing. You should not have nails and your nails should not give the prints. Your nail should not touch to your hand and it should not give the nail print. Remove the nails, then only do mudras. And one more thing, before doing mudras, it's always better to wash your hands. Wash your hands so that there will not be any dirt or anything. Then do mudras for the best result. And there is no nails. Compulsory remove the nails before doing the mudras. Your nails has to not touch. And it should be very gentle. If you keep a lotus petal, it should not crush. These are the basic rules. Few mudras has limitations like time limit, and few mudras you can do for longer time. In our regular classes, I'll tell you like which mudras you have to do for longer time and which mudras you have to do it for shorter time. Everything I'll explain. And Gnana Mudra, the best time is Brahma Muhurta. If you are a student, you want to improve the concentration, you want to get more marks, just do this mudra in the Brahma Muhurta every day for 15 to 20 minutes. Okay. For concentration, now we'll do this. Everyone come to the Gnana Mudra. Keep it on the thighs. If you keep in this way, again the mudra will change. You should always keep it in this way. Back side of the hand should be on the thigh. Keep it on the thighs. Not on the chair hands or on the ground. It's better to keep it on the thighs. To improve concentration, to reduce the thoughts, I will tell a practice. We'll do it now. Here, in this position, whenever you are inhaling, very slightly apply the pressure between the thumb and the index finger. Very gently. When you are exhaling, just release the pressure. But still, see, still they are in contact. While inhaling, just apply the gentle pressure. While exhaling, release the pressure. Okay, we'll do it for 2 minutes. Everyone, if you have any doubt in mudra, show your hands. I will tell you. Yes, right. If any corrections, I will tell you. Keep it closer to the camera. Okay, for 2 minutes. Come to the Gnana Mudra, everyone. Yes, madam, right. Keep it on your thighs. Now, while inhaling, apply gentle pressure on your fingertips. While exhaling, release the pressure. Very gentle. Yes, right. Mudra is right. Madhubala garu, just hands, keep it down. Palms facing upwards. Yes. Again, you keep it here, the tattva will change. This we do in advanced techniques. So always keep it in this. Okay, for 2 minutes, everyone. Sit, spine erect, keep your spine straight. While inhaling, apply the gentle pressure. While exhaling, Release the pressure. But still your fingertips are in contact. Do it. Do it for a couple of minutes and just tell me. See, this is a practical subject. If you do, then only you will understand. Just focus on your breath. Yes, Radhaji, right. You can do it. Just focus on the breath. It's always better to have 1.5 to 2 hours of gap after the food. But in emergency, you can do immediately after the food. No problem. Like bloating is there. If you are suffering with bloating, you cannot wait for 2 hours. Immediately you can do the mudra. No problem. With every inhalation, gently apply the pressure. With exhalation, release the pressure. Last 3 rounds. Generally, after exhalation, relax. Rub your palms. Apply on your eyes. Open your eyes, looking at your palms. How you are feeling? If you do every day, I think any one of you attended my online yoga classes. Long back, I have taken few online yoga classes. There with Mudra Pranayam, I have taught few techniques. It will completely relax your mind. Whoever has attended might have experienced it. Feeling good. See, we have done it for just 2 minutes. Just imagine if you are doing it for every day. Your thoughts will come down. Your mind will be calming down. You will be in a state of calmness. Next. See, it will be like a series of classes where I'll take you in depth into the mudras. Okay, so this again, this is the first session after the long time. So we are only going with the basics today. Even for burning in the food, you can do Jalamudra. Okay. Next one, very, very important one. Have you heard about Sanjeevani anytime? What is Sanjeevani? Or where you heard about word Sanjeevani? Yes. So where you heard about this name? What is meaning of Sanjeevani? Hanuman. Okay. Lives in Ramayana. Very good. Sanjeevani means life giver. Similarly, in our mudras, we have a mudra by name Sanjeevani. This is gift to heart patients. Any kind of heart problem. This mudra is like a gift. Suppose if somebody has problem with that coronary blockage and they have chest pain, if you can do this Sanjeevani mudra, this mudra will help you or save you until you reach hospital. See, you have seen many doctors says, if you have bring him little early, we could have saved him. Okay. If you give a chance or time, they can do miracles, especially in these emergency cases. So this mudra will help you. Like if you had idea, they keep some tablet under the tongue in emergency. So similarly, this mudra has also such potential. And if you are doing this mudra every day, a small blockages you have, it will automatically go. Such a powerful mudra. Or you have breathlessness, ayasa. If you climb 10 steps, you have to what? You have to wait. Again, you have to go. Generally, it is because of heart, right? Because of heart, if you are TM students, you know which point to give. So, in mudras, this Sanjeevani mudra, just to do this mudra for 20 minutes, then climb the steps, you can feel much better. But doing this mudra, even I have read in the books, our Guruji has told, doing this mudra every day does lot of miracles. Even it may lead to natural death. That is the power of this mudra. It helps in gastric, digestion, even in constipation. Even in hypertension, diabetes. See, one mudra, you have so many benefits. The only thing is, you have to do this mudra. This mudra can be done every day. It's a gift. It's a life giver. So how to do this mudra? We have seen the first mudra is Vayu mudra. So what you have to do? You have to do Vayu mudra. Next, you have to touch tip of middle and ring finger with the tip of the thumb. Okay. See, touch the tip, don't touch the nails. Okay. Even if you are unable to make like a circle, no problem. You can touch it. If your finger is not straight, it is bent, no problem. Within regular practice, you can keep your finger straight. Okay. This is Sanjeevani mudra. It is also called as Vayu Apana mudra or Apana Vayu mudra. Okay. So any issues in Apana Vayu means elimination. This mudra is very good. Okay. This is what you have to do. You have to do Vayu mudra first. Then Apana mudra is tip of the middle finger and ring finger with the tip. Middle finger will be straight. Better to do with both hands, and hands should be on your thighs. Sanjeevani mudra. Everybody can do, whether you have issues, health issues or not. This mudra is great for everyone. Even you can prevent. This is good for hypertension, good for hypertension, good for diabetes, good for gastric, good for constipation. Very, very good. It's like a gift to heart patients. Even in kidney problems also, this mudra will help. And you have breathlessness, do this mudra and walk or climb. This mudra will help. For BP, this mudra, you can do it. Especially high BP, it will help. There are other special mudras for BP, but this mudra also will help. In further classes, I'll teach you mudra pranayam. There, where you can feel that calmness in the body, and by regular practice, even you can reduce your heartbeat. Suppose it is beating 80 times or 70 to 80 times. You can reduce it by 2 to 3 breaths. You can give rest to your heart by practicing every day. See, suppose if it is taking rest for even 2 to 3 beats, then imagine how much rest heart will get and how much healthy heart will become. If you are working in day, night, day, night, day, night, how will become after 1 week? You'll become sick. But if you take proper rest, next day, you'll be active. Similarly, if heart gets little rest, then automatically it strengthens. If you see any great yogi, their heartbeat will be very less. Means if your body requires something around 5 liters of blood, 5 to 6 liters of blood, it has to pump. It approximately takes 70 to 80 beats. The same efficiency it is giving you in 60 to 50 to 60 beats. So the pumping capacity has been increased. And this mudra will help you in strengthening the heart or any issues related to heart. So clear so far with the mudras? Now, anybody has previously done any mudra? You got any benefit with mudra? Anyone? You can raise your hands. Gauri ji, Radha ji, you can talk. You can unmute and talk.
Hello, sir.
Yes, ma'am.
Sir, I have a running nose, headache and fever last night. What mudra I should have to do?
Okay. First, what you do Prithvi mudra. Okay.
Okay, sir.
It will balance the temperature. And put black dots at your fingertips.
Yes, sir. I will done that.
Yes. And black it here and do Prithvi mudra.
Yes, sir. I will.
Okay, Prithvi mudra. Ring
Yes,
fingertip.
like
This will help in fever. Okay, when come to Prithvi mudra, I'll explain detailedly. As of now, you can do this mudra. Okay.
Thank you, sir.
Welcome. Prema ji.
Yes, sir.
Namaste, madam.
ಸರ್ ಇದು ಈ ಮುದ್ರೆ ಮಾಡುವಾಗ ನನ್ನ ಬೆರಳು ಸ್ಟ್ರೈಟ್ ಬರ್ತಾ ಇಲ್ಲ.
Problem illa madam. With practice, it will become straight. Okay.
Same problem.
It is, see, when you are doing first time, if stiffness, because of stiffness, you will get it. With regular practice, see, starting you may keep in this way. With regular practice, it will become straight. No problem. You do as you are comfortable. Okay.
Okay.
Okay, madam. Simpa Devamma ji.
ನಮಸ್ತೆ ಸರ್.
ನಮಸ್ತೆ ಮೇಡಮ್.
ನಾವು ಮುದ್ರೆಗಳು ಮಾಡ್ತಾ ಇದ್ದು ಸರ್. ನಮಗೆ ಇಂಗ್ಲಿಷ್ ಬರಲ್ಲ ಅಷ್ಟಾಗಿ, ಅರ್ಥ ಆಗುತ್ತೆ. ಒಟ್ಟು ಮುದ್ರೆಗಳು ಕೆಲವೊಂದು ಮಾಡ್ತಾ ಇದ್ದು, ಅದ್ರಲ್ಲಿ ಅರ್ಥಗಳು ಏನ್ ಆಗುತ್ತೆ ಅದ್ರಲ್ಲಿ ಏನಂತ ಗೊತ್ತಾಗ್ತಿರ್ಲಿಲ್ಲ ಸರ್. ಯೋಗದಲ್ಲಿ ಇದೀವಿ ನಾವು, ಯೋಗ ಹೇಳ್ಕೊಡ್ತೀನಿ. ಆದ್ರೆ ಕೆಲವೊಂದು ಜಲಮುದ್ರೆ ಮತ್ತೆ ಜ್ಞಾನ ಮುದ್ರೆ ಅವೆಲ್ಲ, ಅಪಲ ಮುದ್ರೆ ಇದೆಲ್ಲ ಮಾಡ್ತೀವಿ. ಒಟ್ಟು ಅದ್ರಲ್ಲಿ ಏನ್ ಆಗುತ್ತೆ, ನಮ್ಗೆ ಏನು ಒಳ್ಳೇದ್ ಸಿಗುತ್ತೆ ಅನ್ನೋದು ಗೊತ್ತಾಗ್ತಿರ್ಲಿಲ್ಲ. ಬೆನಿಫಿಟ್ಸ್ ಗೊತ್ತಾಗ್ತಿರ್ಲಿಲ್ಲ. ಇವಾಗ
Madam, I will tell you clearly all the benefits of the mudras. Okay.
ಈ ಮುದ್ರೆ ಗೊತ್ತಿಲ್ಲ ಸರ್ ನಮಗೆ. ಈ ಮುದ್ರೆ
ಸಂಜೀವನಿ ಮುದ್ರಾ.
ಆಮೇಲೆ ಇದು ಸಂಜೀವಿನಿ ಮುದ್ರಾ. ಈ ತರ ಇವಾಗ ಗೊತ್ತಾಯ್ತು, ಇದು ಗೊತ್ತಿರ್ಲಿಲ್ಲ ಸರ್, ಸಂಜೀವಿನಿ ಮುದ್ರಾ ಅಂತ ಗೊತ್ತಿರ್ಲಿಲ್ಲ, ಇವಾಗ ಅರ್ಥ ಆಯ್ತು ಸರ್.
I will clearly explain each mudra. No problem. I'll with benefits, everything I'll explain.
ಥ್ಯಾಂಕ್ ಯು.
Okay. Padmada madam.
నమస్తే అండి.
Namaste madam.
నేను జలనాశక ముద్ర అని వేసుకున్నానండి. ఇది ఇలాగా ఎప్పుడైనా ఇప్పుడు మనము బయట వెళ్ళినప్పుడు అర్జెంటుగా బాత్రూమ్ వెళ్ళాల్సి వస్తుంది, కానీ అవకాశం ఉండదు.
బాగా పనిచేస్తుంది.
అసలు ఎంత బాగా పనిచేసిందంటే అది నాకు చాలా బాగా పనిచేసింది. నేను దాదాపు ఒక 2 years క్రితము 2 years 3 years క్రితం మీ క్లాస్కి అటెండ్ అయ్యానండి.
ఓకే, అటెండ్ అయ్యారా? సూపర్.
అటెండ్ అయ్యానప్పుడు మళ్ళీ ఇప్పుడు అటెండ్ అవుతున్నాను సార్. బాబు నాకు ఇది కావాలి. ట్రైజమినల్ న్యూరాలజీకి ఏమైనా ముద్ర ఉంటుందా?
జ్ఞాన ముద్ర చేయండి. ఎనీ నర్వ్ ప్రాబ్లం, జ్ఞాన ముద్ర ఇస్ వెరీ గుడ్.
ఓకే,
దట్ ముద్ర విల్ హెల్ప్ యూ.
ఓకే, థ్యాంక్ యూ అమ్మా, థ్యాంక్ యూ నాన్న.
See what madam is telling. She has very good case study for the mudras. Suppose we are traveling, especially in bus. If you have urgent urination, but bus will not stop for you, right? In that condition, what to do? In that condition, the beautiful mudra is Jala Nashaka mudra. This is Jala mudra. If you keep at the base of the thumb, it becomes Jala Nashaka mudra. If you can do this mudra, this mudra will help you to reduce the pressure in the bladder. So what happens? At least until you reach your destination, this mudra will help. See, this is, I also experienced personally. Even madam is telling she has very good result. You can also try this. If the pressure is started, immediately you do this mudra, the pressure will reduce on the bladder. At least it will give you or make you feel to sit comfortably. Otherwise, what happens? In that place only we'll do all dance movements. And the bus people will not stop. If they stop also, you don't have proper facilities there. So, this mudra, and one more thing what you can do, in the acupressure, you can either press your kidney points here, or see, when you keep your both hands here, here also there is one kidney point. This is what I have tried. Okay. So just you can press here. Even you can press this point and do this mudra. So this mudra and that point will help you to reduce the pressure. See how beautiful it is. Your body can do miracles. How? The only thing is, you have to understand it. Suppose if you brought a nice electronic gadget, any electronic gadget, if you have brought a digitalized thing or digital remote AC, but you don't know how to operate, then what will you do? You brought it, but you don't know how to operate. Then how you will operate it? Without knowing, if you operate, instead of one button, you will press other button, it will do something. Instead of getting one function, it will get into the other function. At that time, how to operate it properly? Anyone? How will you operate? How you will understand about that gadget? Even you take mobile phone, very good, check manual. So if you go to that manual, what happens? It will give the step-by-step procedure or how to operate it properly. Similarly, this human body also has a manual. Will you agree? Huh? But have you ever gone through that manual? We never care if we got, instead of going to that manual, if you press all buttons, what happens? Again, it will go to the repair. Similarly, what you are doing without reading the manual, you are operating this human body. Then what happens? That's why we are getting all these health issues. If you see our grandparents, grandmother and their mother or their grandparents, they are inlined with nature. They are inlined with circadian rhythm, biological clock. They have listened to their body. They have understood their body and they are given what body needs. If you see festivals, every festival has a special food. Depending on the time of the festival, what food suits the body according to the climatic changes, they have designed these festivals so that your health will be proper way. But here what we are doing, we are modified it and we are eating all the things which body does not suit and we are spoiling our health. So you have to understand the manual of the body and then you go through it, you will be in perfect harmony. We will see many mudras. We will have further class also. In detail, I will tell you all the mudras. Prema Ravi Kumar madam. First spoke. Namaste madam.
ಹಲೋ ಸರ್ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕನ್ನಡ ಬರಲಿಲ್ಲ ಮೇಡಮ್, ಹಿಂದಿ ಇಂಗ್ಲಿಷ್. ಐ ಟ್ರೈ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್.
ಅದೇ ಇವಾಗ್ಲೂ ಅಷ್ಟೇ, ಈ ಮುದ್ರೆ ಮಾಡುವಾಗ್ಲೂನು ಇದು ಕೂಡ್ತಾ ಇಲ್ಲ ನನಗೆ.
ಯು ಹ್ಯಾವ್ ಎನಿ ಡೌಟ್?
ಇದು ಬರ್ತಾ, ಇದು ಜಾಯಿನ್ ಆಗ್ತಾ ಇಲ್ಲ ಇಲ್ಲಿ ಕಿರುಬೆರಳು.
ನೋ ಪ್ರಾಬ್ಲಮ್, ನೋ ಪ್ರಾಬ್ಲಮ್. ಇನಿಷಿಯಲಿ ಯು ಕ್ಯಾನ್ ಕೀಪ್ ಇಟ್ ಹಿಯರ್. Regular practice, you will get it.
ಈ ತರ ಬರ್ತಾ ಇದೆ.
You can, but the regular practice you can do it. If it is coming here also, no problem. You practice.
Okay, done.
Okay. Sir, Prasanna Kumar sir. Sir,
I'm not able to. Hello, sir. Good afternoon.
Very good afternoon, sir.
Sir, I just wanted to know, sir, I'm a diabetic for the last 20 years and odd. I am on my 74th year now. But now, of late, my sugar levels are shooting up after food.
Okay.
So, can I control it through some mudras?
Yes, sir. Mudras will definitely help.
Yes.
You follow our color therapy protocol. What you do is, one thing you can do this Apana Mudra or the Sanjeevani Mudra. You do before food. Before food, because your levels are rising after food.
Yes.
Okay. So it's better to do before food and every day do exercises.
Pardon?
Calf exercises. Just raise your heels up and down.
Acha. Okay, sir. Heels
that
is
will
it?
Also feet. If you raise your heels up and down while sitting in the chair, it will activate your calf muscle.
Okay, sir.
And calf is very important. It is considered as your second heart.
Correct. Yes.
And see, whenever you feel numbness or blood circulation is not, just hit on your calf. Immediately the blood circulation will happen.
Right.
And why? Because your heart, by gravity, it pumps down.
But yeah, that's right.
Feet to heart, calf muscles will help the blood to come up.
Okay, sir.
If calf muscles are weak, then there will be a load on your heart.
Right.
And also, when you are doing these exercises, muscles need more energy. So they will absorb more sugars, more glucose, more glucose.
Fine.
That is
sir.
also your sugar levels will monitor.
Right. Thank you, sir.
And one more.
This Apana Mudra, you said I'll have to do for how long, sir? For both the hands before food?
Sir, you do better afternoon before lunch, you do it for 15 to 20 minutes. In the before dinner also, you do 15 to 20 minutes.
Okay, sir. Both hands.
Both hands.
Right.
And
thank you, sir.
If you have traveled in long flight journeys,
yes,
then even the crew will make you to do these calf exercises.
Okay, fine.
In some crew, they'll make you to do, because
see.
you should not get any problem in the heart or the stroke.
Okay, sir.
They make you to do this. That is the importance of the calf.
Right.
And if you see, olden days, they'll say you are, they'll mention your strength with the calf muscle.
Okay, sir. Right.
So your calves are strong, you are strong. Because it will, if you have gastric, then there will be an impact on your calf muscle. Just gently massage your calf muscle, your gastric issue will go.
Okay,
it improves your digestion.
See, last month I had these carbuncles and I had to undergo a surgery to remove those carbuncles in my left thigh backside, just below my buttocks.
Okay.
Okay. So the doctor said it is because of diabetes the carbuncles have come. So by doing this, I can contain the spread of carbuncles also, isn't it?
Sir, once sugar levels are under control,
there
will be no side effects, right?
Okay, sir. Right.
But it is like how many years you have diabetes?
More than 20 years, sir. 25, 26 years.
It will take time. At least we can first initially you can balance or you can monitor the levels. Okay.
In fact, I attended the color therapy course also. I'm waiting for the English color therapy book so that I can follow the protocols and the colors properly.
So in the further classes, what you do color therapy. You put a color, then do mudra. You'll get very good benefits.
Okay, sir. Right.
That will work great.
Yeah. Right. Thank you, sir. Thank you. Yeah.
Okay, sir. Anita ji.
Sir, thank you so much. Sir, I have this whenever I walk, I have, my heart, I feel breathless, particularly when I climb stairs. So I will do the Sanjeevani Mudra that you told me, but how long should I do it? This is one question. Second is that you told for the Jnana Mudra that, slightly when we breathe in, just press, and when we breathe out, just release. Should that be the same for Sanjeevani Mudra also?
No.
Okay.
No. It should be, suppose you are going to walking. Do it for 15 to 20 minutes.
Okay.
And walk. Initially, suppose you are getting breathlessness after 10 steps.
Okay.
So initially, it will take up to 15 steps, 20 steps, 30 steps.
Okay.
Okay. You have gastric issue. Then also you get the breathlessness.
Okay.
Main reason. So first what you have to do, see in Sanjeevani Mudra also you have Vayu Mudra. First your bloating or gastric issue will solve. And also put the color therapy, whatever protocol is there in the color.
Yeah.
Once the gastric is reduced, your half of the breathlessness issue will solve.
Okay.
Okay.
So which means the heart will also start to function properly if the gastric issue is reduced?
Yes.
Okay. How long to do Sanjeevani
15 to
Mudra?
20 minutes. If it's acute, then you do 15 to 20 minutes and you can do. If it is chronic, then you do morning and evening. 15 to 20 minutes. See, if you are unable to do for 15 minutes or 20 minutes, you do it for 5 minutes, 3 times. Suppose in the morning up to afternoon, you can do it 8 a.m., 10 a.m., 12 p.m.
Sure.
You can do it for 5 minutes.
Okay.
Whatever time I am telling you, it is per day.
Okay. Okay. Okay.
Okay.
Yes.
It is per day.
Yes.
So you can do in a day any number of times.
Okay.
Even 5 minutes is also difficulty. Initially start with 1 minute.
Okay.
No problem.
Yes.
No problem. But slowly you will improve it. But don't strain. Don't press. Very gentle touch. If you press, What happens tomorrow? You'll have a swelling or pain in the hands. Again, you'll tell, sir, you have told mudra, I got swelling.
Okay.
So do it very gently. Take it slow, no problem.
Yes. Thank you, sir.
Do
Just
it.
one more question.
Yes, ma'am.
My husband has a very weak neck. It is going down like this. Is there a way in which he can strengthen his? There is not much pain, but it is, he's tending to go
Better
down.
exercises, madam. Mudras will help to reduce the pain, but their muscles are weak. For muscle strength, we can do Prithvi Mudra. Apart from that, it is strengthening. What happens? These muscles are contracted and these muscles are stretched. So what you have to do, you have to work on these muscles. You have to strengthen this backside muscles so that neck will be straight, and you have to stretch the forward muscles.
Okay. And Prithvi
That will help. Prithvi Mudra will help.
Okay. Yes. Thank you. Thank you, sir.
Welcome, ma'am. Lata ji. I'll come with everyone. Sir, for everything, I'll tell mudras. Okay. Lata ji. Rukmini madam.
Sir, good afternoon, sir.
Good afternoon, madam.
For thyroid, sir, hypothyroid.
Madam, as per now, Vayu Mudra will help.
Vayu Mudra.
Vayu Mudra will help. Any endocrine problem, Vayu Mudra will help. Further classes, I'll tell you other Mudra. But as of now, Vayu Mudra will help.
Then cramps in the leg.
For cramps, you try Vayu. As of now, Vayu Mudra will help.
Vayu
You can
Mudra
do
only.
Prithvi Mudra also, and Vayu Mudra.
Okay, sir. Thank you. Thank you so much.
Okay.
So this Pranavayu we do, no? For after all the mudras are over, finally you have to do Prana Mudra compulsory?
Yes. I'll tell in the end of this session, I'll tell that Mudra.
Okay, sir. Thank you. Thank you, sir.
I'll tell why we have to do also, I'll tell.
Yes, sir. Thank you.
Manchula madam. Yes, ma'am.
Sir. Hello?
Yes, ma'am.
ಕೇಳಿಸಿದಿರಿ ಸರ್?
What, ma'am?
ಕೇಳಿಸಿದಿರಿ ಸರ್ ಸೌಂಡ್?
I can hear.
ఓకే. ಅದು నాకు కొంచెం నీ పెయిన్ ఉంది సార్.
Any pains, Vayu Mudra.
ಹೌದು ಸರ್. ವೆರಿಕೋಸ್ ವೇನ್ ಇದೆ. దాని గురించి
Varicose veins, Apana Mudra.
ఓకే సార్. దీనికి మీరు చెప్పారు కదా బ్రీత్ ఇన్ చేయాలి, బ్రీత్ అవుట్ చేయాలని. దీనికి
only Gnana Mudra. In Mudra Pranayam, we'll see what are the other Mudra techniques. This is only to improve concentration. We are doing in Gnana Mudra, especially.
Okay.
Concentration, memory, we are doing the breathing. Other Mudras also we have breathing. That is different breathing, not this kind of.
ఏనండి ఒకసారి చూపించండి సార్. ఇంకొకసారి వెరికోస్ వెన్ కి ముద్ర.
సంజీవని ముద్ర ఉంది కదా, సంజీవని ముద్ర వేసుకోండి ఇప్పటికి.
ఓకే.
సంజీవని ఉంది కదా, అది వేసుకోండి యాజ్ ఆఫ్.
థ్యాంక్స్ సార్.
ఎందుకంటే దాంట్లో అపాన ముద్ర ఇస్ దేర్ ఇన్ సంజీవని, విచ్ విల్ హెల్ప్ ఇన్ వెరికోస్. Recently, one of the student, just 2.5 months back, she joined my yoga classes.
Okay, sir.
The only thing, doctor has told varicose surgery.
Mm-hmm.
So she want to just try and delay the surgery. Within 2 months, even under the 2 months, 80% pain has gone and the web is become very light.
Okay, sir.
So there is very good benefits.
Okay, sir. Thank you, sir.
Welcome. Jagannath KGS sir.
Namaste, sir.
Namaste, sir.
I have some questions.
Yes,
knee
sir.
pain, neck pain, joint pains, heel pains. How to do? What mudras?
Sir,
And
any pain.
suddenly, one person suddenly heart attack. What mudra will do? In the TM GB41 press, the hang is raised. Patient will become recovered. Mudras, in mudras, what we will do? Suddenly heart attack. So
Yes,
stroke
sir.
patient, suddenly stroke patient.
ಜಗನ್ನಾಥ್ ಸರ್,
Sir.
ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆದವ್ರ ಕಡೆ ಯಾವ ಮುದ್ರ ಮಾಡಿಸ್ತೀರಾ? ಮಾಡ್ಸಕ್ಕಾಗತ್ತಾ?
ಅಲ್ಲ ನಾನ್ ಕೇಳ್ತಾ ಇರೋದು ಏನು ಅಂದ್ರೆ ಇವಾಗ
GB41 ಗೊತ್ತಿದೆಯಲ್ಲ, GB41 ಸಾಕಲ್ವಾ ಒಂದು?
ಅಲ್ಲ ಮುದ್ರಾದಲ್ಲಿ ಯಾವ್ದನ ಇದೆ ಅಂತ ಕೇಳೋದಕ್ಕೆ.
ಎಮರ್ಜೆನ್ಸಿಗೆ ಅವ್ರು ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ, ನೀವು ಮಾಡ್ಬೋದು ಅಷ್ಟೇ, ಅವ್ರಿಗೆ ಮಾಡಿಸ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ ಆ ಕಂಡೀಷನ್ ಅಲ್ಲಿ.
ಅಲ್ಲ GB41 ಪ್ರೆಸ್ ಮಾಡಿದ್ರೆ ಸಡನ್ ಆಗಿ ಹ್ಯಾಂಗ್ ರೇಸ್ ಆಗುತ್ತಲ್ಲ ಸರ್?
ಆಗುತ್ತೆ, ಆಗ್ಲಿ, ಅದು ಒಂದೇ ಸಾಕು. ಎಮರ್ಜೆನ್ಸಿ ಕೇಸಲ್ಲಿ ಒಂದ್ ಸಾಕು. ಮುದ್ರಾ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ. ಮುದ್ರಾ
ಮುದ್ರಾನಲ್ಲಿ ಎಮರ್ಜೆನ್ಸಿ ಕೇಸಸ್ ಅಲ್ಲಿ ಯಾವ ಮುದ್ರಾಸ್ ಮಾಡ್ಬೋದು ಅಂತ.
ಅವರಿಗೆ ಆ ಟೈಮಲ್ಲಿ ಮಾಡಿಸೋದು ಬೇಡ, ನೀವು ಇನ್ಫಾರ್ಮೇಶನ್ ತಗೊಂಡಿರಿ.
ಅಲ್ಲ
ಬಟ್ ಆ ಕೇಸಲ್ಲಿ ಅವ್ರಿಗೆ ಮಾಡಿಸ್ಬೇಡಿ.
ಮಾಡ್ಸೋದಿಲ್ಲ ಇನ್ಫಾರ್ಮೇಶನ್ ಗೋಸ್ಕರ.
Okay. You can give information. Okay, sir.
See, whatever we are doing is alternate therapy.
Yes.
This is not emergency therapy. This therapies will help.
Yes.
But this is not emergency therapy. In any chance of heart attack,
yes,
Sanjeevani Mudra will help.
Okay.
But you cannot take, this is emergency treatment. This mudras, whatever it is, definitely they will help. And in the case of any kind of pains in the body, Vayu Mudra will help. You can do this mudras.
Any pains in the body, joint pain, heel pain, neck
any
pain,
because of increasing of Vata, this Vayu Mudra will help. Okay, for each particular pain, there is other mudras also, but at the basic level, this mudra will help. I recommend everyone, if somebody has body pain, first I'll start with Vayu Mudra. And in our regular classes, we'll see other mudras also. At that time, you will understand what are the other mudras we have to do.
Yes.
Okay, sir? Sumangala, madam.
For heel pain, which mudra we will use? When we walk, then we pain will come.
Understood. Heel pain we have done for many people. You have this calcaneum spur or plantar fascia?
Just
when
you
have that
walk,
bone or just the muscle under the feet?
Just walk. When we'll walk, no, that time he will pain.
Understood. That is because of one spur will come, bone will increase. For that also you'll get pain. Plantar fascia, if that muscles are stiff also, you'll get pain. Okay. So for that, as of now, you do Vayu Mudra. There are few exercises for that, which will give very good result. Because in heel pain, it has worked great. But as of you do Vayu Mudra will help.
Okay. And one more question for creatinine.
We have a Makara Mudra, kidney Mudra. In the further classes, I will tell you about the Mudra.
Okay.
Next, Madhubala madam.
नमस्ते सर।
नमस्ते
सर मैं हिंदी में बात कर सकती?
जी।
सर एक तो ये पूछना था मुझे, मैं ऐसी जगह बैठी हूँ, मैं डेली आपकी क्लास अटेंड नहीं कर पाऊंगी, तो आप ये पेड क्लास कब से स्टार्ट करने वाली हैं? तब तक हो सकता है मैं अपने घर चली जाऊँ।
वो आपको अपडेट मिलेगा, you'll get update from the academy.
आई थिंक सितंबर में शुरू करेंगे, मैं सितंबर स्टार्टिंग में चली जाऊंगी घर।
As of now, they'll see the schedule and they'll update you.
Okay sir. One more thing sir, आपने बोला कि वॉक करते टाइम भी हम मुद्रा कर सकते हैं, तो वॉक करते टाइम मुद्रा हम किस टाइप से करेंगे? मान लीजिए मैं प्री डायबिटिक हूँ, तो मैं संजीवनी मुद्रा कर सकती हूँ उसके लिए?
संजीवनी कर सकते हैं अगर इमरजेंसी में, मगर नहीं करे तो अच्छा है। इन इमरजेंसी वॉकिंग में कर लो। Okay, in emergency you can do in walking, but if it is not required, better to sit peacefully, comfortably and do mudra. That will help you.
Okay sir.
Okay.
तो उसके लिए संजीवनी मुद्रा ही होगी ना सर?
हाँ, अगर आपको ब्रेथलेसनेस है वैसा है तो you do संजीवनी मुद्रा and then you do walking.
Okay sir. Thank you sir.
You're welcome. Usha madam. Sanjeevani mudra for hypertension. BP you do Sanjeevani mudra. Yes, madam.
Sir, namaste.
Namaste, madam.
Sir, you said Sanjeevani Mudra for breathlessness and all those things, no? While going on steps. For people who don't have any heart problems or any breathlessness
They can
and
do.
those things, while climbing the, what my question was, while climbing the hills, normal people also will get breathlessness, no? While in that position, can we do that?
In
Mudra?
that position you can do, but what you have to do it, that is because lack of oxygen at the higher altitude.
No, lot of steps while climbing. Normal
You'll get.
people
That
also
is for anyone
get
you'll get.
breathlessness.
Okay.
Yeah. So,
You are climbing. That the best way is to strengthen your lungs by doing pranayam. Then you can climb steps very easily. People who go for treks, generally they come near me before 1 month or 2 months. I'll teach them all the breathing exercises so that they'll not get any issue during the treks. Your lungs has to be powerful, strong, while climbing so much. Okay.
Okay,
That their mudras, Sanjeevani mudra will help. There are few more mudras like Adi mudra, Prana mudra. One mudra I'll teach in the end.
Okay.
Okay.
Thank you.
Yeah. Purnima madam. Madam, unmute.
Namaste, sir.
Namaste, madam.
Sir, for anxiety and depression, which mudra is?
First you do Vayu mudra to reduce the thoughts.
Okay.
Then you do Jnana mudra.
Yeah. For heart palpitation and
Sanjeevani.
same.
Sanjeevani. Palpitations you do Sanjeevani, immediately you see the result.
Okay, sir. Thank you.
Okay, madam. Gauri madam.
Thank you so much for this class. I am a yoga therapist and also I've learned dance. So these mudras come in a curriculum for us, the Hasta mudras and all. My query is the advanced level for a person who has the first stage of Parkinson, that is slight shaking of the hands currently. It's a male, about 50 years of age. Now, this person is, I have given Vatanashaka mudra for this person. Should I, followed by the regular mudra? So is there any other thing that this person can inculcate in his daily life?
Okay, see, this is called as Kampavat, a type
Yes,
of
sir.
path. Okay,
Okay.
what you can do is, there is Vatanashaka mudra, what you said.
He's been doing, yes, sir.
And then you can follow by Jnana mudra.
Okay. And not Prana mudra, as in like?
Prana mudra in the end.
Okay, so
After all
3 in this
mudras,
thing.
after the all mudras, and you have to end with the Prana mudra.
Okay. No, this he's been following, but how effective is this thing is my query. Like, because not much of a thing. I also wanted to join TEM class, but I couldn't get hands on that particular time. But yeah, and also such sessions, we are on mute, so we really can't get that chance to ask questions in especially this academy and all. Now I've joined this color numerology. Let me see if I can get some kind of result in that. That was
Yeah, see, you have Kannada group and different groups where seniors are giving the protocols, are always support you. They are helping us. Because see, this academy has very huge amount of students, like very wide spread. Okay, sometimes what happens, if hundreds of questions are coming at a time, it will take some time. Because we cannot answer thousands of questions in a day. So it will take
no,
time.
my
As of now, you followed by Vatanashaka, followed by Gnana Mudra in the end of Prana Mudra.
Okay.
Apart from this, what are the other symptoms we have? If you are doing color numerology, then we have TM course will also be there. So you also use that points. That will also help.
Correct.
Because whatever you are using color mudra, take time. You know, as a yoga teacher, nothing will happen overnight. Even for a body to adapt to a kind of workout, it takes 6 months to 1 year. You cannot go immediately. You cannot get six-pack these bodies.
I agree.
So here you try this because it's related to Kampavat. And by doing mudras, we need other assistance like Ayurveda, any in our traditional therapies. That will give much better results.
Agreed.
Okay, you try combinations will always work much better.
Perfect, perfect. I just wanted to add one thing for the rest of the class also. All these mudras need to be done at the same time. It gives you maximum result. Like if someone is doing the prana mudra and all, like, you know, every day if you're doing consistency is the key to get amazing result. Do it at the same time. If you've started at 8, do it again tomorrow at 8 o'clock. You know, now you start practicing. So it gives amazing result because I myself as a yoga therapist with my students, I practice this and it's very wonderful. It's a hidden therapy, you know, but it's very wonderful.
And see, whatever we are seeing now, it's just Hasta Mudras. I am teaching just in a therapeutic way. And mudras are done in the 3 different domains. One is Natya Mudras, where you do in dance to express the bhava. Next one is in rituals. By doing puja, you will do different mudras. And third is in yoga. For yoga, we are doing therapeutic, and Hasta Mudras are not mentioned in any yogic text. In yogic text, they mentioned about Mano Mudras, Kaya Mudras, Adhara Mudras, and Bandha Mudras. Okay. Just by simple Hasta Mudras, you are getting so many benefits. If you just imagine you are doing the advanced Mano Mudras or Kaya Mudras, even in yoga, they say you have mudras like Kechari, where you can conquer your death. You have Viparita Karni. So they are very advanced mudras. But here we are seeing only about Hasta Mudras. Okay. And at the end of the day, we have to end with Prana Mudra. The Prana Mudra will help in restlessness to increase the energy levels. Because whatever mudras you are doing, that mudras results will enhance by doing Prana Mudra in the end. And it's always better before doing Prana Mudra, there is one more mudra called as Adi Mudra. Adi means, what is Adi? Means the starting or the root. Right? Because this is the first mudra we do as an infant. So this is called as Adi Mudra. This is Adi Mudra. There are methods, you know, how children will keep their hands. Small babies. This is Adi Mudra. Do this mudra and then followed by, in the end of the day, suppose you are doing 4 mudras. Do all the 4 mudras and then before sleeping or in the night, you do Prana Mudra. Or end of the 4 mudras, you do Prana Mudra. Again in the evening end, you have to do Prana Mudra. This is touch the tip of little finger and ring finger with the tip of the thumb. Okay. This is Prana Mudra. What happens? See, we are living because of prana, the vital energy. That vital energy will enhance. Both hands. Always do it with the both hands. And you know, according to the Prashnopanishad, that is that Prahlada and his disciples, The disciple will ask him the question and he will answer. In that, about this Pancha Pranas, they have mentioned very clearly. Hruday Prano Guday Apana Samana Nabi Mandale Udana Kantadesastu Vyana Sarva Shariraga. Means they have clearly mentioned what is the prana residing at which place and which system it is governing. In that we have seen apana vayu mudra, apana. If apana flow is not proper, then you will have constipation. If prana is not proper, then your lungs will be weak, then your immunity will go down. Samana related to digestion, udana throat and above, and vyana related to the circulation. In that, the prana, the main, the vital energy, what is there, it will improve even your lung capacity. During COVID first wave, lot of people have got affected through lungs and their oxy level meters are falling down. In that condition, Adi Mudra followed by Prana Mudra has helped them to recover and increase their oxy level meters within 3 to 4 days. And one condition, if you have low BP, better to avoid Adi Mudra. In high BP, this mudra will help. Low BP, just avoid this. Even after surgeries also, people will have these issues. Like their oxy levels again falls down. So in that condition also, this mudras will help. It is like if it's like one of these case study, one of my student, after surgery, oxy levels has fallen to 70. By doing Adi Mudra and Prana Mudra, within 3 days, it has improved to 90. So, always, in the end, you do it with, end with the Prana Mudra. And when you do the combination of Adi Mudra followed by Prana Mudra, it enhances your lung capacity. It increases the main immunity. Even if you are getting sick always, this mudras will help you. You are getting cold, frequent weather changes, this mudras will help. Okay, now you understood the sequence. So it's better to, you can do n number of mudras. There is no restriction that you have to do 1 or 2 mudras. But initially, don't overstrain your fingers so that you will get pains. Do it very gently. And how these mudras work, just everyone come to the Gnana Mudra, close your eyes and observe, keep your focus at the fingertips. Everyone. Just focus at the fingertips and tell me your observation. What is happening at your fingertips? Yes, Madhubala madam. Anyone you can take.
सर दोनों thumb and finger दोनों में vibration feel हो रही है.
Vibration, can you feel something is passing? Anyone?
Yes, sir. Yes.
See what
This is
happens.
passing through thumb and finger. Passing
Yeah.
through the finger.
I'll tell you what happens exactly in mudras. What happening? This is the main. The energy is passing. So by placing fingers in different position, we are doing, by doing different permutations and combinations, we are doing different circuits. If the energy has to go to the brain, we'll do one combination. If it has to go to the spine, then we'll do one more mudra. It has to go to heart, we'll do one more mudra. Whatever the energy we are continuously emitting out from our fingers, we are redirecting it. So whatever energy is out, instead of going it out, we are redirecting it and sending it to the place where we need energy. If in heart energy is less, we are doing a mudra, the energy is going to heart. In spine you need energy, we are doing a mudra, it is going to spine. You need it in the brain, it is going to brain. So this is how the mudras will work. Have you understood? And why, you see, as a child or as a young adult, we have lot of energy. And they say you became old. Why? So your energy levels has reduced. So for our everyday work, we do meditation. In sleep, we'll get energy. By doing meditating, by doing pranayama, we'll get energy to our day-to-day activities. When energy is draining out, what happens? We'll become old or weak. So instead of going these energies out, rishis, the ancient rishis understood it, yogis understood it. They are not wasting the energy. What they are doing, they are redirecting it. So what happens? Our energy, again, we are sending back and we are giving to the organ. This is how they used to live youthfully, mindfully. So that is power of mudra. That's why see yogis at 70s, 80s, even at 100 plus also, they are very youthful, very mindful. Then they are very energetic because not wasting their energies, and they are always gaining the energy by doing pranayama and meditation. So that is power of yoga. That is power of mudras. That is power of pranayama. Understood? Very good. So this is how you have to do. If you do mechanically, there will be no use. What? If you sit, if I say pranayam, what you sit, you are thinking somewhere else. You do pranayam, you will not get any benefits. You have to do it with mindfulness, with consciousness. Mudras also, if you are talking, if you are doing something, you'll do mudras, you'll get benefits. But for the best benefit, you have to sit, you have to do it with mindfulness. See, when you are concentrating here, you can feel something is flowing. But previously you have done mudras. Have you felt? From starting of the class, we are doing mudras. In the starting, have you felt it? Why? Because your mind is somewhere. So you cannot feel. This is what you have to adapt. See, yoga is nothing, you no need to do Sirsasana or any advanced asanas. It is as simple. If you are eating, eat consciously, eat mindfully. That is also yoga. Okay. If you are reading a book, read with complete concentration. Okay. But you are here in class and it is already 12:55. It is lunch time. What I have to cook or what is there in the stove, whether I have to have off the stove or not. Your concentration is there. Then can you remember this? So that will not help. Whatever you do with mindfulness. Okay. So we'll end with a story. Ready? How many of you ready for story? Very good. So we basically, the South Indians or the people from southern part of the country, very much fascinated about tiffins, right? Every day we need what idli, dosa, pongal, different types of tiffins. So one day what happened, a person like us has went to a very famous Udupi hotel. All over India, it's very famous. It is from Karnataka, right? So went to nice hotel. He has ordered a plate of idli. Very health conscious like us. No oil food, nothing. Just ordered a plate of idli. Listen carefully. When he has brought a plate of idli, what happens generally? They will bring 4 to 5 plates at a time, or 10 plates, or students are they are like few students of Basavaraj side like us. They were discussing about color therapy and TM. So what happens? His concentration might have been diverted. What happens? Little sambar has spilled on the idli. Immediately that person started shouting on the waiter. Have you seen this kind of persons anywhere? Generally, if you go to a hotel or you will see. Yes. Why he has shouted on the waiter? What might be the reason? You can text. What might be the... very good. I think TM student. Liver hang has increased. Next. General. High BP. Okay. Think normally, generally. More vayu. Like everybody is expert therapist here. Any other reasons? Too much focus on idli. Okay. Here, ego. Okay. Here, I will introduce a word. What is the word? Observe carefully, listen carefully. The word is expectation. What is the word? Expectation. What is the expectation? Idli has to be white. Idli has to be round. Chutney should be in the bowl. Sambar should be in the bowl, right? But what happened once that sambar is spilled or chutney is spilled, he got angry because of expectation, right? Here, I will introduce one more word. What is that? First one is expectation. The second word is reality. What is the word? Reality. If he understood reality, what is the reality? Anyway, you have to eat idli with sambar and chutney, right? Huh? If he understood reality, will he get anger? What is the reason? Expectation, reality. Okay. When both matches, will not get anger. Clear? Okay. Now we'll keep this idli, our TV, everything aside. We'll come to real life situation. What happens? Either in the family or whether you say some work to your kid or friend or anyone. 9 out of 10 times they will come, they will do the work. But 10th time, what is the expectation? They have to come, they have to do the work. But what is the reality? If you say for the children or anyone to do some work, they might have exam tomorrow. They have to study. But what is your expectation? That they will do this work. But what is the reality? They have exam and they have to study. Even for friend, we call him to come and pick up or some other work. Expectation is they will come. The reality is they might have some job interview or something. Then what happens? If they say no, I can't, then what happens? Cut it. Now you understood the difference? Just apply this same scenario in the somebody is saying they'll get angry. Why? Why you will get angry? Why he got angry? Expectation is here and the originality is here. You have to balance. Just apply it to your real life scenario, whatever happened, you will understand. what is the root cause. If you can digest this one thing, many things will solve. Okay, just do it as a homework, and I'll see you on the next week. Up to that, everyone, please do mudras. Okay, do the homework. We'll catch up in the next week. Namaste.